Here is the latest legislative news from the Texas Hospital Association, March 20th, 2023. The most jam-packed week of committee testimony for THA thus far this session included not just talk, but action as well, as THA's vehicle for addressing workplace violence passed out of committee, becoming the first THA bill of this session to clear that milestone. The House Committee on Public Health voted out House Bill 112 by Representative Donna Howard, the Democrat from Austin, on Tuesday, making the bill eligible for consideration by the full House. Like its companion, Senate Bill 240 by Senator Dr. Donna Campbell, Republican from New Braunfels, the bill requires all hospitals and healthcare facilities to maintain a workplace violence committee and implement annual individualized violence prevention training. It also permits retaliation against someone who reports a workplace violence incident. Violence in hospitals has been a heightened concern since the beginning of the COVID-19 pandemic. A recent THA workforce survey revealed more than 60% of hospitals seeing an increase in violence severity since the pandemic began. SB 240 itself was under examination on the other side of the Capitol, with THA Assistant General Counsel Heather De La Garza testifying in support of the bill last Wednesday in front of the Senate Committee on Health and Human Services. THA testified 2 other times during the week to oppose a pair of measures that pose problems as drafted. Senate Bill 1197 by Senator Bob Hall, Republican from Edgewood, would introduce new monthly reporting burdens on hospitals related to their existing requirement to report suspected cases of child abuse to the state. Hospitals would be required to submit a monthly report containing the number of times it reported alleged or suspected child abuse, exploitation, or neglect, as well as any code the hospital used for diagnosing or treating the alleged or suspected victim. A committee substitute for the bill adds another requirement for each monthly report to contain attachments of signed affidavits from hospital agents or employees who made an alleged or suspected abuse report during that month. THA General Counsel Steve Woleb testified Wednesday in the Senate Health and Human Services Committee against the bill, noting hospitals' lack of infrastructure in place to meet its proposed requirements. House Bill 1001 by Representative Giovanni Capriglione, Republican from Southlake, which would adjust the language of existing consumer choice health plan law and open the door for insurers to offer a larger number of cheap plans with potentially scant coverage. De La Garza told the House Select Committee on Healthcare Reform Thursday that, as written, House Bill 1001 potentially erodes the gains Texas has made in ensuring quality comprehensive coverage is available to Texas citizens. THA is working with Representative Capriglione and hopes to arrive at language that would instead help further those gains. Also Thursday, THA registered its support on a measure that would extend postpartum Medicaid coverage for new mothers to 1 year instead of the current 2 months. THA is in staunch support of coverage expansion, as Medicaid covers more than half of Texas births and more than a quarter of the state's maternal deaths occur between 43 days and 1 year after delivery. Join us again next week for more updates from the 2023 session of the Texas Legislature.